a lot of people may be concerned about metabolic health. And when they go to their doctor, it's routine for them to maybe be offered a metabolic panel, which will include a glucose check, a blood sugar check at that particular time. But what are some other labs that people can consider or that you do for your patients to kind of assess their metabolic health?
I think it's a great question because so many people are learning about the term metabolic health, and just to keep it simple, blood pressure, blood sugar, your lipids, and your waist. And what we find is that they're associated with cardiovascular disease, stroke, dementia, cancer. So we want to know about this because you can pretty much prevent or mitigate the risk for a lot of these chronic conditions. So other than the obvious one, which is glucose and your A1C. The A1C is important because it tells you what your blood sugar has been running for a while. But I think it's important, all clinicians who have a person in front of them should get a C-peptide, because a C-peptide will predict, is your islet cells actually making insulin? And if your islet cells are not making insulin, that's already a problem. So you want to identify that in the beginning so you'll know whether it's type 1, type 2 diabetes, or just the risk of metabolic disease in general. Another test that people should consider and ask their clinician to get is a fasting insulin. It's such a cool test because it'll predict your risk for diabetes 5 to 10 years in advance, because your pancreas, if it's working overtime to control your blood sugar, it may make your blood sugar test look okay. But if it's high, it means that diabetes is on the way. And probably 70% of those with a high insulin level will end up with diabetes in their lifetime. So we want to know that. Some other tests that are important are like the C-reactive protein. And the C-reactive protein is a blood test that you can measure. And it's important because your liver releases more C-reactive protein into the bloodstream, if you have inflammation. So if you have a high C-reactive protein, it's a sign that you have inflammation. A very easy test to do that your doctor can order. There's one called a homocysteine that you may have heard of. And believe it or not, a lot of the B vitamins, B12, I think B6, folate, they break down into homocysteine. They make chemicals that your body need. So if your homocysteine level is high, you may have a vitamin deficiency, believe it or not. And if you have that vitamin deficiency and your homocysteine is high, your risk for dementia, heart disease, and stroke are higher. Other tests that doctors need to think about, LDL cholesterol is something we focus on, but we shouldn't because it has large and small particles. And if you have large particles, probably not so big of a deal. If you have small particles, which can get into the crevice of your arteries, that's a big deal. So instead of just doing an LDL, or let's say it this way, if your LDL is high, ask your doctor to break it down into the particle sizes, and that'll give you a better indication for your risk for heart disease, which is why LDL is not even in the list of metabolic markers that we worry about. And then a few more quick ones, apolipoprotein beta A ratio. There's one called a lipoprotein small particle A. And then if you're worried about metabolic stress and oxidative stress is almost like, when there's free radicals floating around, they can't find partners, causes a lot of inflammation. You don't want that. That's what COVID did also. So what you want to do is check a few things that measure that. One is bilirubin. And if the bilirubin is increased, that could be an indication for metabolic stress. There's one called GGT. That's another one that when it's not normal, that could be a sign of oxidative stress. And then another one called uric acid. We think about uric acid for gout, but in reality, uric acid can be elevated if you're at risk for high oxidative stress, obesity, hypertension. So those are the tests. There's more, but I think those are a good starting point. And if we can get people to ask their clinician who may not be as familiar with these tests, that's where I would start.
Yes, thank you for that. That was a very thorough overview. And I was sitting here thinking, do you do this panel for everybody, or are you taking into consideration family history, or if it's a woman that had a history of gestational diabetes? How are you picking and choosing?
That's a great question also. Well, only 7% of us are metabolically healthy. So I tend to do it in many people. I think you start because there's a cost issue. A lot of us are patients who have financial barriers. So I kind of give them fasting insulin level is a no-brainer. Not a lab, but a great test is a coronary artery calcium score. And our health system, it only costs. I work for Advocate Health, and it only costs $50. So I would start at a financial level, that's okay. But then when you start ordering apolipoprotein Bs and small, particle size for cholesterol, that can be a financial barrier. So if you're going to do those tests, ask your clinician, what do they think those costs would be? They're worth it. And something like an apolipoprotein small particle A, you only really have to get that one time, because that's a test that'll say your risk is high or low. And then you adopt a lifestyle that'll mitigate that risk. So I think absolutely money's a real issue. And I think you pick the ones, but I do it in most patients to get started, but I'll negotiate with them which tests we're going to do.
I understand. Okay. Thank you. Thank you.
It was my pleasure.